the problem is that you are drilling till the green line, after you wait for the healing, and after the healing, let's say that the blue is the bottom part of the circus, you will have a blue line, the bottom part of the circus, the black line is the equigingival line, and after we will identify, the technician together with the doctor will identify a red line, that it is the line where we are going to decide that our crown will close. This is an area, the red line is a line that we decide according to the future emergence profile. If we have problems of short abutments, let's say of retention, we can move between the black line and the blue line as we want according to our prosthetic needs. Let's say that the red line usually is in the middle between the black line and the blue line, and this is, in this image, where our crown will close. With vertical preparation there is never a fixed point. There is an area, and we can decide according to our prosthetic needs where to move in this area.